What is hysteroscopy? Hysteroscopy is the most effective approach to determine whether your uterus is healthy and capable of carrying a pregnancy. It enables a direct visual examination of the cervical canal and uterine cavity to detect any uterine abnormalities that an ultrasound scan could have missed. The uterine cavity, endometrial lining, shape, and volume of the endometrial cavity can all be seen using hysteroscopy. Hysteroscopy is sometimes recommended to obtain endometrial tissue for tubercular testing as well. IVF treatment is one of the challenging infertility management procedures. Hence, it is critical to conduct the appropriate preliminary assessments and preparations in order to improve the treatment's success. One of the elements that can boost the success of IVF treatment is the proper preparation of the patient. Hysteroscopy is specially recommended in couples who have had previous miscarriages or problems with implantation. Also, a hysteroscopy assists in getting more decisive information than the HSG report. Hence, it is regarded as the gold standard for uterine assessment. Hysteroscopy is recommended for appropriate preliminary assessments and preparations of the uterine lining before embryo transfer, boosts the success of IVF cycle, provides more decisive information than the HSG report, identifies uterine issues more precisely. Surgical hysteroscopy treats uterine abnormalities, improves conception rates. However, it should be well understood that pre-IVF hysteroscopy aids in boosting implantation and pregnancy rates, but not live births. So how does a hysteroscopy work? You will be sedated or given general anesthesia first. Then, through your vaginal and cervix, a narrow tube with a telescope is pushed into your uterine cavity, which is sometimes filled with 0.9% of saline solution or normal saline or carbon dioxide gas to broaden the cavity in order to see the inner lining of the uterus. The best time to have a hysteroscopy is 4 to 9 days after the onset of menstrual cycles. Finally, small equipment is inserted into the uterus through the hysteroscope if a surgical correction is required. The visuals are recorded after being viewed on a screen. Recurrent pregnancy loss is defined as 2 or more unexpected pregnancy losses before the 20th week of pregnancy. Uterine abnormalities are one of the most prevalent causes of recurrent pregnancy loss, and hysteroscopy is the best way to discover and treat them. Intrauterine causes of pregnancy loss can be detected and treated using hysteroscopy, including intrauterine adhesions, polyps, submucous fibroids, and Mullerian abnormalities. As a result, women who have had 2 abortions may be advised to get a hysteroscopy, which will reveal any deformities or disorders and help them to have a better pregnancy outcome. 3 times failure of a good quality embryo to implant into the uterine wall during an IVF treatment is considered to be known as recurrent implantation failures. Hysteroscopy aids in assessing uterine receptivity as well as detects and treats intrauterine causes of implantation failure, including inflammation, adhesions, and undetected polyps, which might be overlooked on transvaginal scan and can lead to IVF failure. Is it compulsory for IVF patients to undergo a hysteroscopy? Routine hysteroscopy before every IVF round is not recommended. However, no study is conclusive and each patient is unique. Because it provides individualized care, your fertility doctor is the best person to analyze your case. Hysteroscopy might take anywhere from 5 minutes to over an hour to complete. The length of the procedure is determined by whether it is diagnostic or surgical, as well as whether another technique such as laparoscopy is performed concurrently. Diagnostic hysteroscopy, on the other hand, requires less time than the operative hysteroscopy. What are the benefits of hysteroscopy? Hysteroscopy not only aids in the accurate diagnosis of uterine problems, but it also assists in the direct treatment of uterine disorders when your hysteroscopy transitions from diagnostic to surgical, such as polyp, fibroids, uterine septum, uterine adhesions. Thus, infertility in patients due to endometrial receptivity, impairment of embryo implantation, and mechanical interference with sperm and embryo transport can be well handled. Operational benefits of hysteroscopy. Compared with other, more invasive procedures, hysteroscopy provides the following operational advantages. Shorter stay in hospital. Recovery time is reduced. Lesser amount of pain medication required. Chances of avoiding open abdominal surgery. Hysteroscopy is considered a daycare surgery and does not usually require an overnight hospital stay. An overnight stay may be necessary in some rare cases, such as if your doctor is concerned about your reaction to anesthesia.